I'm Delanne Elliott Midland, and I am the co-founder of the End Brain Cancer Initiative. So thank you for joining us today for the End Brain Cancer Initiative's Caregivers, Self-Care, and Tools webinar. And this is our series number 2 this year. Today's webinar is focused on financial toxicity with the idea of how do you escape financial toxicity with a oncology or a neuro-oncology diagnosis. Our keynote speaker today is Aimee Hoch, is going to be presenting today on a very important topic, navigating the costs of care and what financial toxicity is. We actually all might think we already know what financial toxicity is, but you know what? I don't think we do. I think there's way more to learn in this particular space. And so Aimee's going to teach us today. Aimee, so she's a licensed social worker, but she's way more than that. Aimee, her credentials include OSW-C. Tell us what that is.
Oh, that's a certified oncology social worker.
Thank you. Also, FACCC.
Okay, that's an organization, the Association of Cancer Care Centers. I'm a fellow for that part of that organization.
Fantastic. So she's a master's level in licensed social work with over 30 years of experience in the healthcare and behavioral health area. Her practice is focused on oncology, specifically addressing financial toxicity. Aimee earned her master's in social work from Fordham University Lincoln Center campus and is a certified oncology social worker. I think it's actually really important we talk about a certified oncology social worker just for a minute, Aimee, because I know your patient population, right? And social workers are phenomenal, and they all should be part of our team. But I do think it's important if we're talking about oncology, talking about cancer, that we're working with a social worker who is certified in oncology as a social worker. I do think the resources that they're aware of maybe are much more than we would get with a other social worker who's not certified in oncology. Aimee is an integral member of the oncology financial advocacy team at St. Luke's Grandview Campus, formerly Grandview Health, where she created and launched the financial navigation program in 2018. Wow. Thank you for doing that. That's a great model for others to use. Thank you. Nationally, she served as a financial navigation specialist for the Cancer Support Community Helpline, and I think you're going to talk a little bit about that later, and frequently speaks on the topics of financial toxicity and financial navigation in cancer care. She is a fellow of the Association of Cancer Care Centers, ACCC, and serves on its Financial Advocacy Network Advisory Committee and is the incoming chair. Oh, congratulations for 2026 through 2027. Congratulations. Aimee also contributes to several other key organizations, including the Medical Advisory Board of Living Beyond Breast Cancer, the Pennsylvania Cancer Coalition Quality of Life and Survivorship Workshop, and she co-chairs the Pennsylvania Oncology Navigation Network, which is PONN. I'm just sort of thinking, wow, you're doing an awful lot. Amazing. Thank you so much for your commitment.
Oh, thank you. Thank you so much for having me. Hello, everyone. Like Delanne said, my name is Aimee Hoch, and St. Luke's is about 45 minutes north of Philadelphia. So I'm in Pennsylvania, and I'm honored to be a part of the caregiver series at EBCI. I'm really glad you're here today. I know that for many people facing a cancer diagnosis, whether a patient or a caregiver, the emotional, physical challenges are very overwhelming. So today we're going to talk about one part of that journey that often doesn't get discussed enough, the costs of care and what's called financial toxicity, and the financial strain or stress that can come along with a cancer diagnosis. mean, cancer care has certainly come a long way. We have more treatment options and more hope than ever before. But along with that progress, the cost of treatment, care, and even everyday living expenses can become a burden. So, my goal today is to help you understand what financial toxicity is, why it happens, when it happens, and who you can reach out to for help. Then, our next presenter, Jennifer, will share information about insurance, assistance, and resources to help. So, let's start by talking about what financial toxicity really means and how it can show up during the cancer journey. When we talk about financial toxicity, we're really talking about the financial side effects of cancer treatment. This term was first coined in 2013 by Dr. Safar and his colleagues at Duke, and describes, and this is his definition, the objective financial burden, the actual financial burden, and the subjective financial distress experienced by patients as a result of the cost of care. It's the stress, anxiety, and hardship that patients and families experience because of the cost of care, things like medical bills, travel expenses, lost work time, and insurance gaps. You might also hear it called financial hardship or financial distress. I often use the terms interchangeably. You'll hear that through my presentation, but they all describe the same experience. Many people find themselves having to make difficult decisions, like choosing between paying for medications or other essential needs. And that kind of financial distress can affect quality of life. We know that it affects treatment outcomes and overall well being. The good news is that by recognizing it, talking about it, bringing awareness to it, both on the provider side and making sure that everyone has access to a financial navigator at every single cancer center is part of my mission, but also for patients and caregivers, because it's hard to ask for help. So my hope is that by unfortunately sharing that it's common, it lets you know that you're not alone in this experience. So let's take a look at what's causing the financial toxicity that individuals and families experience. Financial toxicity is also framed about treatment cost, but we're going to talk about what's really impacting it. So the cost of cancer care is projected to reach $246 billion by 2030. New and expensive treatment combined with improved survival and longer treatment impacts spending. And individuals on oral therapy are particularly vulnerable to high out-of-pocket costs. And when you couple this with non-medical costs, loss of income, or a fixed income, it becomes a huge financial burden. Now let's take a look at what's causing the financial toxicity that others experience. And it's often focused on treatment, and you heard that in the definition, but we know that it goes beyond that. So beyond the cost of treatment, there are things such as the type of insurance and coverage you have that impacts the financial toxicity you experience, what your out-of-pocket costs are, if they're very high compared to someone who has more full coverage, the bills you receive. I often have people just so overwhelmed with the amount of bills that they receive that I say, bring them in. We're going to sort through them together. That can be so overwhelming and add to that distress. The prior authorization process can be extremely stressful, and going through the denials and going through that process. Having multiple appointments with different providers, your copays are adding up the more appointments you have. And then when you add in reduced work hours, loss of employment and income, that also further impacts it. We also need to consider, when I'm working with someone, I'm always considering their situation prior to treatment. So if they're already maybe coming to me and just diagnosed and are on a fixed income already, these now extra costs in their life are going to be a huge financial burden. There's increase in daily living costs. Your geographic location impacts the level of financial toxicity you experience, whether you're in an urban or rural area. There are travel costs. And there are absolutely costs for caregivers having to take time off of work, loss of income. So we know financial toxicity goes beyond treatment costs, but how many people experience it and how many are accessing the help that they need? This study was aimed at understanding the scope of those experiencing financial toxicity. And according to the findings, 74% of participants reported financial distress at a level of 5 or above on a scale from 1 to 10. That's a substantial majority. Other statistics reinforce the extent of the problem, showing that financial toxicity is not just common, but a problem experienced by many. And what's particularly concerning is that despite the high level of distress reported, only 40% of those affected actually access any form of financial support or assistance. This gap highlights a critical need for more awareness, resources, and accessible support systems to help individuals manage the financial burden. Let's take a look at what decisions individuals are often faced with in order to manage their cost.
Aimee,
Yes,
can we go back to the slide, please? Okay,
sure.
this particular slide that you're showing is really important. What is striking me and bothering me is, however, only 40% of patients, families, caregivers used resources such as financial counseling or financial assistance. Now, you probably have a pretty good idea why that is, right?
Sure. Yeah.
Are you going to be covering that, or do we want to talk about that just a little bit now?
I kind of wrap up with it, but I think it's important to talk about. So there are a couple of factors. So I have a few thoughts, Delian, but chime in if you have a thought as well. So the one thing I know for sure is that not all cancer centers have a financial advocate or a financial navigator. Another thing you'll hear later in a story I share is that it's not a one-time thing. So it's not just about your first treatment, getting copay assistance for it, and then you're good. And I'll share that a little bit later. Also, there may be somebody there. Sometimes the department's called financial counseling at hospitals, but they generally are there to help people who are uninsured and help them apply for Medicaid, or they're helping to facilitate what's called financial assistance, or otherwise known as charity care applications. Not
Right.
this critical, proactive financial navigation from diagnosis through into survivorship. So part of my hope that you all take away, and I'll touch on too, I know for many reasons how hard it is to ask for help in this area. It's a very vulnerable situation when you're sitting there with your physician and you're worried about the cost. I've had through all my years of working with people, learning that they're worried about being offered a different type of treatment, not the standard of care that's cheaper. And just for many reasons, talking about finances, it's not something any of us are comfortable doing, especially we just were diagnosed and, sharing that with our doctor. So there's that too. And I think my hope and goal, main message for this, if you don't have somebody like me coming to you, please ask somebody on your team, because you'll see with my story I'm going to share how common and prevalent and it's a long-term thing that we need to navigate. So Delian, I'm not sure if I hit upon everything, but
You did, Aimee. And what I'm thinking of, and I know people don't know this, oftentimes people do not know about this. The fact is that the minute there is a diagnosis, and I'm just going to say any cancer diagnosis, any disease diagnosis, and honestly, I think one of your very first things you should do within the hospital is ask for the appointment to the social worker. The social
yeah,
worker is also known as, there's another term within hospitals, case manager sometimes.
yeah,
Sometimes I mean it. Ask for the appointment like immediately and then talk about whatever it is you want to talk about. But in this particular case, it's like I want to be connected to financial resources. I want to, if they have a financial navigator, I want to be connected immediately to that person. I think we don't know that these people exist within a lot of healthcare systems, right? And they are there to help, but patients, the general public doesn't even know that they're there to help.
Yeah.
And I think if there's anything we can do, one of the things that we want this particular webinar and the videos, educational videos that will be made out of this webinar is to that big takeaway is there's resources right there within the hospital starting. I would start with the social worker. That's where I would
Yeah.
start, that you just don't know about, but you can have access to them. The other thing I would say is do not be afraid of potentially the stigma of the word financial navigator, right?
Yeah.
People like you were saying, people don't want to talk about the finances. That people don't, blah, 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 blah. I don't want anyone to know my finances or the fact that I actually might need some help. I don't want to deal with that. I certainly don't want to share it with anybody. But a financial navigator is certainly there to help the patient and the caregiver and the family. And they really are part of your team. And I love someone wrote in, who has been in this space for a very long time. She wrote in, I have never even heard of a financial navigator before the recent ABTA conference, which was held in September, the patient conference. It's a newer term, right, Aimee?
Yeah, I mean, I've been doing it for quite a while, and the term financial toxicity has been around for a bit, but in my work nationally, there are so many cancer centers and treatment centers that don't have a financial navigator yet. So it still is new. It's very much in its infancy. But I
Right.
like that you mentioned not to be afraid of the term. We're not a part of like billing or patient accounts. I'm not setting up payment plans for anyone. And I think you also made another good point, Delanne, that you might not know that there are resources available and you really haven't had to use your insurance to the extent that you're about to. So you couldn't know what you're facing. And meeting with someone like myself, but Delanne, you're right, going to the social work first is key because there's generally going to be a social worker in every cancer center. So if they do have a financial advocate, they can point you in that direction. But if not, they may be the person helping you with all of this. That's where I started before I developed our program. So really important information.
Wonderful. Thank you, Aimee.
You're welcome. So we'll go to the next slide and talk about the sacrifices that this study found individuals were making. And this is a study from Dr. Chino and her colleague. She's now at MD Anderson, but she was at Memorial Sloan in New York. And these findings are striking. Nearly half of the patients, 49%, were willing to declare bankruptcy. Additionally, 65% reported being willing to make other financial sacrifices, such as borrowing money to cover the cost of care. And alarmingly, 38% were willing to sell their home to cope with these expenses. And you'll hear this in the one story that I share. It has happened. I've worked with people that have had to move. These numbers show how deeply financial toxicity can affect not just finances, but overall well-being and stability. So patient sacrifices reveal the personal toll of financial toxicity, but these struggles extend across multiple areas of life. Let's look at a framework that can help us understand the full scope. Tucker Seeley helps us break down financial hardship into three interconnected domains: the material, psychosocial, and behavioral. Understanding these help us not just like know there's a financial impact, but how it truly affects individuals in other ways. So the material domain, that's these tangible out-of-pocket financial burden that someone faces. So The direct financial strain, the cost of care, copays, medication, loss of income. The psychosocial domain helps us understand the stress, anxiety, worry, social isolation related to financial hardship, and the impact overall on one's mental health and social well-being. And the behavioral domain really includes and help us understand those changes in health-related behaviors that a person is faced with, and like trade-offs, delaying, like canceling appointments, delaying care, kind of skipping medications and stretching prescriptions over a longer period of time and able to reduce the financial burden. Now let's talk about financial hardship or toxicity and when it's experienced. So like I mentioned, it's from diagnosis, and it's never too early to ask to meet with someone, a social worker, financial advocate, financial navigator at your treatment center. Because financial toxicity is not just about that one-time need when you first get started with treatment and somebody helps you with a foundation to pay for that cost. It's through treatment changes into survivorship and follow-up, and even into end-of-life care. So individuals can experience financial stress at multiple points along the cancer care journey. And it's a persistent challenge that can emerge at any point and many points. Recognize it across the continuum of care is key to providing care that truly supports individuals, not just clinically, but financially and emotionally as well. And for patients and caregivers, know that you're not alone. I share this so that know that you'll be partnering with the advocate long term and each step of the way. So understanding that financial toxicity in cancer care isn't just about the cost of treatment, it's about how unmet financial needs can affect the person's overall well-being. And one way to conceptualize this is through Maslow's hierarchy of needs, which helps us see how financial strain can impact everything from basic survival to self-actualization. So starting with the physiological or basic needs at the bottom of the hierarchy, where cancer care providers can consider these. It's different for an individual to access care that's being recommended if we're not meeting those basic physiological needs or going to that support group. So if somebody's struggling with food and housing, utilities, they're not going to be able to access care. So we need to look at the whole picture and the whole person. And if we think about the physiological needs, that's someone struggling for food, medications, paying for housing, their monthly bills. And then that safety level is actually where healthcare falls in. So if we're not helping with those physiological needs, access to the care can be difficult. And it also means like that security feeling of insurance coverage or job loss, anxiety around medical bills. And the love and belonging here is really about the strain on relationships due to financial stress, and the esteem needs, feeling like a burden or loss of independence or self-worth is important. So we really need to look at the whole picture. When a patient is facing financial toxicity, their unmet needs can ripple upward, affecting safety, relationships, mental health, and even the ability to pursue meaningful goals. So keeping this framework in mind, next I'd like to share a story with you with the emphasis on how all copays and all costs count. This is someone I worked with. We'll call him Steve, 55 years old. And at the time of his brain cancer diagnosis, he was employed with employer-based coverage. I helped him apply for short-term disability through work, eventually SSDI. He had a loss of coverage. We then assessed him for Medicaid. He was awarded his SSDI, and then we helped navigate him to a marketplace plan. So all of the interventions that I provided are in green, and in black are kind of the needs that Steve had. So this is going to illustrate how it's really a whole picture and not just a one-time intervention. So for his infusion treatment, we used copay assistance, and then when he had full coverage with Medicaid, it covered it in full. But like I mentioned, all costs and copays count. You don't just have your treatment costs. There are office visit copays, scans, physical therapy. I'm leaving out many other services, but other services and providers. And what we did is we applied for hospital financial assistance for those. I
Amy, I have a
also can,
question.
sure.
Amy, sorry to interrupt you.
No, it's okay.
I'm assuming SSDI is Social Security Disability.
Yes, sorry.
Okay.
Yes.
Thank
Yeah.
you. And then Steve, you helped Steve apply for short-term disability, STD, through work.
Yes.
Can I ask, in Steve's case and your experience, once you helped Steve apply for short-term disability through his work, how long did it take for his short-term disability benefits to kick in?
I can say all policies are different based on what your employer offers and what you've opted into. Like
Yes.
I have two options. Some of them have longer waiting periods than others. So if you pay a little bit more each month in your benefits for a short-term disability policy that is only a 2-week waiting period compared to, say, a month waiting period. So it's hard to say exactly, Delanne, but they all vary. But there generally is a waiting period before the income starts.
Yes, absolutely. And then, and eventually Social Security disability. And it's the same. That takes a while to kick in. There's a waiting period for that as
Yes.
well. And it's also, as you stated, every policy is definitely different as far as what the percentage is related to Social Security disability, correct? Do you know?
The policy for short-term disability.
I'm now on short. So, oh, yeah. Sorry. Yes.
That's
Yes.
okay.
Yes.
Social Security disability. So Social Security disability is based on work credits, ability to work or not, medical information. But when you mentioned a policy for short term disability, they're all different and
There
they're through
are.
your employer or some states offer short term disability, like California is one, New Jersey is one. So it's going to vary with short
Mhm.
term disability.
Thank you. Now, in
Yeah.
Steve's case, related to his infusion treatment, you were able to help him locate copay assistance, correct?
Yes.
Okay. Are you at all able to talk about that copay assistant, what that looked like for him?
So, just in general with copay assistance, and I know Jennifer's going to touch on it too. It can be either a copay card through a manufacturer if you have commercial insurance, or sometimes we look at foundations. Generally, for those who have Medicare, some commercial private plans. So that umbrella of copay assistance includes both copay cards and foundations.
Thank you. That's very helpful. Thank you.
Sure. Yeah. And then hospital financial assistance, that's through the hospital. I mentioned it earlier. Like there's generally financial counseling at each hospital. They will help you with that application. And that's for all those other copays, for all those other services. And I've had people forgo some of those because they didn't know hospital financial assistance was there. For instance, physical therapy is often a co-insurance. So it's not just a copay, it's a larger out of pocket cost with some plans. And so, such a vital, important service in your overall wellness and well being that many of my patients were forgoing that. Also, palliative care. So, once I found out about that, we put things in place to make sure they knew that this help was available. And then there's other costs, and that's how myself and the social worker work so closely together for non treatment related costs, such as grant programs for transportation, housing, household bills, food insecurity. And I know you'll hear a little bit about some resources about them later. I do want to mention there's sometimes outside testing company bills, like for biomarker or molecular testing companies. And I like to mention that sometimes you get a pretty large bill for those, even though you have insurance coverage. But just know that they have internal financial assistance programs built in. And then I wanted to mention the other, cost that counts is caregivers' time away from work. And I helped his wife navigate FMLA. And this was ongoing, and I needed to monitor the changes at all times.
So the FMLA, it's Family Medical Leave, what?
Act. I am
Act.
so sorry. I keep talking in abbreviations. It's the Family Medical Leave Act. Yes.
Thank
You
you.
would talk to your HR department about that.
Thank you. And what is that?
So it's a law, it's a federal program. It generally gives you 12 weeks of time off that can be taken consecutively or intermittently. It kind of is a protection for your position, and employers that have 50 or more employees, or kind of federal, state institutions like schools or the people that work at your county, they have to offer it. So it's really a placeholder for your position. It is not income. So people generally alongside of that will use their PTO or vacation time or their short-term disability. And so they go side by side, but that's what the Family Medical Leave Act is.
Thank you.
Sure. So I also wanted to mention non-treatment related needs, and many cancer centers are really needing to assess for these now. We built a whole food insecurity program at our cancer center. We have a screening tool for all these. Our inpatient side also does as well. So we need to recognize that these are also a financial burden and address these as well. And generally, like I mentioned, I partner with the social worker who helps with these. We kind of partner together there. So, and I mentioned all of that in Steve's story too. I'm just going to take you on a little journey, and this really illustrates that addressing financial toxicity is long term, that my role and your experience may be similar. So in 2019, I met with this individual. This is someone I worked with, and she was just diagnosed. And that's when I started the cost of care conversation to start building that trust and let her know that I'm here to help support her. At that time, she had commercial coverage through work, and you'll see how I help navigate her through many different income, treatment, and insurance changes along the way. So she had chemotherapy and copay assistance at the time, and she was working. And then in 2020, she had a loss of employment and insurance. And with a fund for premium assistance, because she had met her out of pocket already for the year, we were able to help her afford Cobra and have that full coverage for the remainder of the year and continue treatment. We knew that wouldn't be sustainable into 2021, so we looked at a marketplace plan, and it wasn't sustainable because of the premium each month was a burden for her. So we looked at a marketplace plan with a lower premium. She had a change in treatment, and we were able to use a manufacturer copay assistance card to help her meet her out of pocket in her first treatment of that January, which gave her full coverage for the whole year. She could access her care without any interruptions. I helped her apply for Social Security Disability, which is SSDI, and she continued to access her treatment. So in 2022, I recognized based on her household income that she was going to be eligible for Medicaid. So she moved off the marketplace plan and onto Medicaid with full coverage again for another year in 2022, continuing her new treatment. And then in 2023, because she had been on Social Security disability for 2 years, she became eligible for Medicare. And this often is a financial burden, becoming eligible for Medicare, because you're paying a lot each month for coverage. So she enrolled in A, B, a supplement, and a Part D, and with premium assistance was able to afford the cost of her premiums and continue full coverage again. And I just want to say that through that, there's always different life events. This is a person that lost her home that she built with her husband and raised her family. A lot of changing roles. She also became a caregiver herself for her husband. He ended up with a different health need. So it's really also helping navigate through those transitions as well.
Aimee,
Yes.
the person you're talking about that you helped in 2023, I believe I understood this correctly, with full coverage with premium assistance. So it's full coverage. Was that for the Medicare, A, B, and D supplements?
Yeah, and actually, this is the same person across
Yeah.
a timeline. But
Okay.
when she was eligible for Medicare, she had original Medicare A and B she enrolled in, and she paid for a supplemental plan, which can be high, or what's known as a Medigap plan, and then also had to purchase a standalone Part D plan. So because all those premiums become a financial burden, I was able to go to an outside foundation that offered premium assistance and help her apply for that. And that helped her for another year pay for her premiums.
Thank
They
you.
depend on if they're open at the time. It just happened to be open, the fund that, and I helped her apply for that.
That's fantastic because I'm going to be honest, she likely would have no idea about how to
Yeah.
navigate this, even if she felt good enough about doing it, feels it physically and mentally, she probably wouldn't know how to navigate and definitely go to the foundation you're speaking of for
Right.
the premium assistance coverage. So thank you.
Yes. It's very complex. Enrolling in Medicare is overwhelming.
Yes,
Yeah.
it is. And
Right.
if you can't pay, yeah, and if you can't pay for those premiums,
Right.
you know, so that I bring this up only because I want those listening to understand that within your hospital setting, even though there sometimes are not financial navigators, there are social workers who can help also and connect you, I think, Aimee, right, with financial navigators or the financial department.
So they generally at hospitals, the financial department help with like Medicaid and charity care applications. But I could say, and at the end, I'll share, if where you can find help if you don't have a financial navigator. But specifically to Medicare, a really good thing to know is that every county in this whole country, you can go on ship.org. They have a directory of to the county office on aging. It's called something different in every state and every county, but basically every county office on aging department has what's called SHIP counselors, and they are unbiased Medicare counselors. They are volunteered, which makes them unbiased. They are not getting a commission on plans. They are very highly trained. So if you go to ship.org, you can put in where you live and it will route you to the right SHIP counselor and county. Yeah, State Health Insurance Program, I believe it stands for.
Thank you.
You're welcome. Okay, so of course, I just want to reiterate and we'll wrap up at the end. Please ask your social worker or anyone on your team, your nurse navigator, if you could speak to a financial navigator or financial advocate at the time of diagnosis. It's never too early to ask. You'll start to build that relationship with that person, and then they're there to help you navigate through all those changes. Ask to speak to a social worker. They may be the person handling this at the cancer center, but if there are both of us, they're going to help with all of those non-treatment related needs. I just wanted to point out some resources. The End Brain Cancer Initiative, like Delian said, there's insurance navigation there. The American Brain Tumor Association, they have a care line. Cancer support community, you could call in and be connected to financial navigation through their helpline. OncoLink. So the rest are kind of websites that are extremely helpful with webinars, videos, tools, things you can print out that are really helpful with navigating all of this. OncoLink, Triage Cancer, and Cancer and Careers. And I'll end there and just say thank you so much for having me today. Yep, there are
Thank
my
you.
references.
Thank you, Aimee. Hey, I do have a question for you, Aimee. Thank you very much.
Sure.
The helpline that you respond to, you are on the other end. Cancer, what is the organization again?
Support community, cancer
Yeah.
support community.
Yes. Can you talk about that a little more?
Sure. I don't answer the line. There are navigators and social workers who are there. I believe it's 8 to 5. It's a national organization, cancer support community, with local offices. You may be familiar with Cancer Support Community and Gilda's Club, but their national helpline, you can call in for support, any needs. And then if there is a financial need or insurance need, they will make the referral to one of us.
That is amazing. I wish I had known about that resource, right? A
Yeah.
long time ago, or even today, to be honest.
Yeah.
There's so much that's hard to understand.
Yeah, and I will say that if you have a financial advocate or navigator in your cancer program, they're really the ideal person because they know your treatment team, right? They know your treatment, your doctors, the area, but if you don't, that is an incredible resource. Like we mentioned, many treatment centers don't have that role yet. So,
Mhm,
yeah,
mhm.
just
I
wanted to
wanna
mention that.
Yeah. Thank you for creating the financial navigation program that you created,
Oh,
and
thanks.
thank you for talking to us. Thank you for doing that. You've really started something that's so necessary, and really appreciate it. I do think about patients and their families, and I know that the burden, financial toxicity, financial burden gets in the way of treatment. And I also know that when we think about disease and we think about cancer, we know that stress is just a big bad factor for that particular disease. And so
Yes.
we have to figure out a way to create less stress on these patients and these caregivers and their families caused by financial toxicity. So thank you for doing your part.
You're welcome. And just a correction, it's shiphelp.org, and I put it in the chat for you.
Thank you so much. Yay.
Thank you for having me.
Before you go, if anyone else has any questions, please put it in the chat if you would, so that we can grab Aimee before she signs off, if she's signing off. Just because this is such an opportunity. I hope it's okay, Aimee, also, the helpline that you were talking about, I mean, anybody can call it, right?
Yes, anyone can call it. Yep. Caregivers, um, patients, anyone can call it. And they offer a lot of different services.
I wanted to make sure everyone saw your email address. I also wanted to make sure everyone had the phone number for the Cancer Support Community Helpline, which is 888-793-9355. And that is open to everyone. Thank you, Aimee, so much for sharing that resource as well. Okay, as we wrap up Aimee's presentation and our questions, and really, thank you so much, Aimee. I feel like there's so much we just talked about that could be its entire segment for a disease
Yes.
education video, to be honest. So thank you so much for highlighting several things that were helpful and for us to learn from. Thank you.